Good evening, friends. Welcome back to the channel. Today is August 12, 2026, and we are covering an urgent and rapidly evolving global health crisis, major new FDA approvals, groundbreaking clinical trial data, and sweeping healthcare policy reforms. Segment 1, Global Health Emergencies, the Ebola Crisis in the DRC. We begin in the Democratic Republic of the Congo. The World Health Organization, WHO, and local health authorities have issued an urgent appeal as the death toll from the current Ebola outbreak has officially topped 2,000 individuals. What makes this specific outbreak incredibly dangerous is the pathogen responsible, the Bundibugyo species of the Ebola virus. Unlike the more common Zaire strain, for which the international medical community has established effective vaccines and treatments, the Bundibugyo strain currently has no approved preventive vaccines or therapeutic interventions. Data coming directly from Dr. Mohamed Janabi, the WHO Regional Director for Africa, reveals a stark reality. Between 60% and 70% of all Ebola-related deaths are occurring directly within local communities before patients can ever reach a specialized treatment center. The epicenter remains heavily concentrated in the DRC's Ituri province. The primary barrier to saving lives right now is late intervention. Because the virus is outpacing local tracking infrastructure, patients are succumbing to the disease far from clinical settings. Current response and trials. In an effort to catch up, the UN Health Agency alongside the Congolese government is urgently intensifying its field operations. Fortunately, because clinical trial protocols were established before the outbreak was declared in mid-May, vaccine and treatment trials have launched with unprecedented speed. Vaccine trials have already been authorized in Canada and the United Kingdom, while experimental treatment protocols are actively being administered on the ground in Ituri. However, representatives from the WHO R&D blueprint warn that definitive efficacy and safety results from these trials are still several months away. Segment 2, FDA breakthroughs and regulatory decisions. Todrukev approval for advanced melanoma. Moving over to pharmaceutical regulations, the United States Food and Drug Administration, FDA, has expanded its oncology arsenal. The agency granted accelerated approval to vuselimogene odoperipec WTPG, marketed under the brand name Todrukev by Replimune Incorporated. Todrukev is a genetically modified oncolytic viral therapy designed to treat adult patients suffering from unresectable advanced cutaneous melanoma. This approval specifies its use in combination with the checkpoint inhibitor nivolumab for patients who have shown resistance to standard therapies. The approval was granted under the FDA's accelerated pathway, leveraging data on objective response rates and duration of response. As part of this mandate, the manufacturer must conduct post-approval confirmatory trials to continuously verify its clinical benefit. Clinicians should note critical safety warnings associated with Todrukev, which include the potential risk of accidentally transmitting or reactivating herpes infections due to the viral architecture, as well as localized complications at the injection site. Orzifil, a first-in-class narcolepsy treatment. In another major regulatory milestone, the FDA approved Takeda's oveporexton, commercially known as Orzifil. This marks a monumental shift in neuropsychiatric medicine, as Orzifil is the first oral selective orexin receptor 2 agonist approved to treat narcolepsy type 1, NT1, in adults. Narcolepsy type 1 is a chronic neurological disorder driven by the profound loss of orexin-producing neurons, which govern human sleep-wake cycles. Standard treatments have historically focused purely on managing superficial symptoms, such as prescribing stimulants to combat daytime drowsiness or sedatives to manage cataplexy. Orzifil changes the paradigm by directly targeting the underlying pathophysiology of the disease, working to mimic the missing orexin signaling. Dr. Tiffany R. Farshan of the FDA Center for Drug Evaluation and Research highlighted that this medication addresses the condition holistically rather than forcing patients to manage fragmented symptoms across multiple prescriptions. FDA rejection, item 11. It is not all green lights from the regulatory body, however. The FDA issued a complete response letter rejecting the approval of Isotope Technologies' Munich radioligand therapy, superscript 1 luidotriotide, item 11. The therapy was under review for the treatment of gastroenteropancreatic neuroendocrine tumors, GEPNETS. Crucially, the FDA did not cite any concerns regarding the clinical safety or efficacy of the drug, nor did it demand new clinical trial data. Instead, the rejection stems entirely from chemistry, manufacturing, and control (CMC) issues, alongside third-party facility inspection failures. Data from their Phase 3 COMPETE trial demonstrated a median progression-free survival of 23.9 months with the radioligand compared to just 14.1 months with the standard everolimus, meaning the company will be working aggressively to resolve facility issues for a rapid resubmission. Segment 3: Breakthrough Clinical Research and Longevity Science. The rise of next-gen weight loss, aleniglipron. Turning to metabolic health, data published this week shows that the landscape of obesity management is rapidly moving away from needles to highly potent oral options. An experimental small-molecule oral GLP-1 receptor agonist called aleniglipron has delivered highly competitive weight loss results. In a 36-week clinical trial tracking adults with obesity or overweight, the once-daily pill helped participants lose up to 12.1% of their baseline body weight. Unlike standard blockbusters like Wegovy or Ozempic, which rely on peptide structures requiring weekly subcutaneous injections, aleniglipron's small molecule design allows it to withstand stomach enzymes, making it a highly effective daily pill that could drastically improve long-term adherence. Belly fat versus BMI for cardiovascular risk. For years, the medical establishment has relied on body mass index, BMI, as the gold standard for classifying health and disease risk. However, a major cross-cohort study published in the Journal of the American College of Cardiology reveals that measuring waist circumference and waist-to-hip ratio is significantly more accurate at predicting true heart disease risk than BMI. The data indicates that individuals with normal BMI metrics but high central adiposity, excess belly fat, face a sharply reclassified, higher risk of major adverse cardiovascular events. This signals a shift toward clinicians incorporating regular waistline tracking rather than relying on weight-to-height charts alone. Lp(a) the hidden genetic threat. Sticking with cardiology, a massive study tracking over 20,000 individuals has identified a massive, silent threat to public health, lipoprotein A, or Lp(a). The study revealed that approximately 1 in 5 people carry genetic variations that lead to abnormally high concentrations of this specific cholesterol-related particle. Elevated Lp(a) levels were strongly tied to a higher incidence of ischemic stroke and premature cardiovascular death. Because standard lipid panels look only at LDL and HDL cholesterol, this genetic risk factor often flies completely under the radar until an acute event occurs, prompting calls for universal, once-in-a-lifetime Lp(a) screening. Diet and mental health, the fruit juice study. Can a minor dietary addition alter clinical mental health outcomes? A randomized controlled trial published in the British Journal of Nutrition evaluated the impact of adding 100% fruit juice or smoothies to a standard diet. Over a 4-week period, the group adding juice or smoothies saw their depression scores drop by 2.52 points on a 27-point scale compared to the control group. Metabolic markers showed no adverse changes, and tracking indicated that participants used the juice to complement, rather than replace, their intake of whole, fiber-rich foods. While researchers emphasize that a small, short-term trial cannot definitively prove direct causation, it offers a simple, accessible dietary strategy to support mental well-being alongside structured therapies. Segment 4: Healthcare System Reforms, Infrastructure, and Policy. India's massive insurance reform push. Next, we shift focus to International Healthcare Administration, where the Government of India is currently designing wide-ranging health insurance reforms aimed at tackling hyperinflation. Driven by regional medical inflation running at an unsustainable 12% to 14% annually, a joint panel of regulators, hospital chains, and the Confederation of Indian Industry, CII, is standardizing industry rates. The cornerstone of this reform is the implementation of benchmark treatment rates across hospitals to eliminate arbitrary pricing, alongside the rapid integration of the National Health Claims Exchange. This centralized, uniform platform acts as a digital bridge between hospitals and insurance corporations, standardizing documentation to accelerate claim settlement speeds upon patient discharge and weeding out the estimated 10% to 15% of claims that are fraudulent or unwarranted. The cross-practice medical debate in Maharashtra. Meanwhile, a fierce clinical and legal debate has reignited in the state of Maharashtra. A newly notified government policy allows graduates of Bachelor of Homeopathic Medicine and Surgery (BHMS) programs to prescribe modern allopathic medicines, provided they complete a 1-year medical bridge course. The state government argues this is a necessary move to counter severe rural doctor shortages. However, modern medical associations are raising serious patient safety concerns. Critics contend that a brief one-year certificate course cannot safely replicate the deep diagnostic training, intensive clinical exposure, and emergency room management skills taught across a traditional 5.5-year MBBS degree program. Junior doctor shortages and systemic strain. This policy debate comes amidst profound systemic strain across multiple Indian states. In Kerala, public and private healthcare facilities are facing critical staffing shortages as junior doctors take mass leave to study for the upcoming NEET PG medical entrance exam scheduled for August 30th. This mass departure coincides with a massive seasonal monsoon epidemic, forcing thin medical staffs to handle up to 12,000 outpatient visits a day in single sectors. Simultaneously, in Andhra Pradesh, the Junior Doctors Association of Judah officially withdrew non-emergency medical services starting today, August 12, following failed negotiations over stipend adjustments and heavily expanded, 3-hour longer outpatient shifts. Furthermore, a formal human rights complaint filed against BJ Government Medical College in Pune reveals that first-year postgraduate residency students are routinely forced to work brutal 24 to 36-hour shifts continuously without any weekly time off, underscoring systemic physician burnout issues plaguing medical infrastructure. Segment 5: Global Clinical Infrastructure Incidents. The Cali Hospital Collapse. We close today's broadcast with a serious infrastructural incident in South America. On Monday, a powerful 7.4 magnitude earthquake struck Colombia, causing severe structural failures across the region. Tragically, the major hospital Universitario del Valle, located in the city of Cali, suffered a partial catastrophic collapse. Video footage from the scene captures the horrifying moments medical teams rushed to evacuate critically ill patients, newborn incubators, and intensive care equipment out into the surrounding streets. Specialized search and rescue teams are currently working through the rubble as hundreds of staff members and visitors are still feared trapped within the collapsed wings of the medical compound. Global disaster relief health organizations are currently mobilizing emergency field hospitals to support Cali's displaced patient population. Term check: ovaparexton, brand name Orzifil, is verified as a first-in-class oral selective orexin receptor 2 agonist approved by the FDA for narcolepsy type 1. Preeclampsia, placenta under stress. Some of the earliest changes were seen in the placenta, particularly in early-onset disease. Extravillous trophoblasts, the fetal cells that normally invade the uterus and remodel spiral arteries that improve blood flow to the placenta, were reduced and failed to reach deeper uterine layers, which likely impaired placental blood flow, Medscape. Fournier gangrene, an aggressive form of necrotizing fasciitis that affects the perineum and external genitalia, can occur following minor perineal manipulation in women without immunodeficiency, they wrote. About 30% of Fournier gangrene cases occur in otherwise healthy individuals, but have a mortality rate of about 40%, the authors wrote. When it occurs in women it may be initially misdiagnosed as a gynecologic condition which can delay definitive management. MedPage Today. Hashtag outro and community discussion. That wraps up today's news update for August 12, 2026. Please subscribe to my channel for more such updates and share your views in the comments below. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.